Bismillahirrahmanirrahim. Today we will start first semester subject Introduction to Public Health Management. My name is Ebunisa and working in FIMS. First we will define the health. According to the WHO, it means that World Health Organization, health is the complete state of physical, mental and social well-being, not merely the absence of disease or infirmity. Public health we will define according to World Health Organization. Public health refers to all organized measures, whether public or private, to prevent disease, promote health and prolong life among the population as a whole. Its activities aim to provide conditions in which people can be healthy and focus on entire population, not on individual patients or disease. Thus, public health is concerned with the total system and not only the eradication of a particular disease. The Center of Disease Control and Prevention Foundation. Public health is the science of promoting and improving the health of families and communities through promotion of healthy lifestyles, research for disease and injury prevention and detection and control of infectious diseases. Overall, public health is concerned with protecting the health of entire population. This population can be as small as local neighborhood or as big as an entire country or region of the world. This is the definition which World Health Organization set. There are three types of prevention. One is the primary prevention, second is the secondary prevention, and third one is the tertiary prevention. While primary prevention is the intents to prevent the development of disease and the occurrence of injury and thus to reduce their incidence in the population. Secondary prevention is really the treating disease after it has developed so that there are no permanent adverse consequences, while the tertiary prevention is concerned on the focuses on the optimum treatment of clinical apparent and clearly identified disease to reduce complication to the greatest possible degree. Public health and prevention. Public health focus on primary prevention. However, there is also an interest in secondary and tertiary prevention. Public health focuses secondary and tertiary preventions to ensure access to effective clinical care rather than providing the care itself, preventing long-term consequences of health problems and limiting the progression of illness, disability and disease independent on access to excellent medical care. Access to primary care and specialties has historically been a target of public health initiatives. These are the determinants of health. There are many factors that has great influence on the health of the individual and the community. The healthcare, behavior, health practices, genetic inheritance, social environments and physical environment. Determinants of health. There are two types of environment. One is the natural environment and one is the built environment. Natural environment is defined by the features of an area that includes its topography, weather, soil, water, animal life and other such attributes. Health threats include weather-related disasters such as tornadoes, hurricanes, earthquakes, as well as exposure to infectious disease agents that are endemic to a region. While built environment is defined by the structures that people have created for housing, commerce, transportation, government, recreation, and so on. Health threats include exposure to toxins and unsafe conditions, particularly in occupational and residential setting. Determinants of health. This is a social environment. There are the major organization concepts of human life. Human life deal with community, society, occupation, family, social network, and religion. All these factors has a great effect on human life. Determinants of health, social environment. Divided into two parts, informal rules and formal rules. Informal rules are religious, political, economic, and organization, while formal rules are religious, political, economic, and organization. Informal and formal rules govern our everyday lives. These rules are based upon values, beliefs, and norms. Ultimately, these rules affect how individuals live and behave, their relationships with others, and what resources and opportunities individuals have to influence their lives. Social environment, status, resources, and power, racial and ethnic group, and socio-economic status. Social environment is an important aspect of this. It's an important aspect of the social environment is the status, resources, and power that individuals have within their social environment. Socio-economic status is a combination of education, occupation, and income or wealth which is associated with significant variations in health status and risk for health problems. Racial and ethnic status indicates that disparities exist between racial and ethnic majority group. Determinants of health, genetic inheritance. Disease processes are determined both by environmental and genetic factors. These usually interact, and individuals with a particular set of genes may be either more or less likely, if exposed, to be at risk of developing a particular disease. Determinant of health is the health behavior. Health behaviors refers to behaviors that harm health. Some of the nation's leading causes of death are due to health behavior, causing disease or a condition. This is suicide, chronic liver disease, cirrhosis, essential hypertension, hypersensitive renal disease, and assault. Public health. This is the big picture of public health. What is public health? The sum of all officials or governmental efforts to promote, protect, and preserve the people's health. Public health definition is, it's the science and art of preventing disease, prolonging life, and promoting health and efficiency through organized community effort. According to Oxford Dictionary, the process of mobilizing and engaging local, state, national, and international resources to assure the conditions in which people can be healthy. According to American Heritage Dictionary, public health is the science and practice of protecting and improving the health of the community as by preventive medicines, health education, control of communicable diseases, application of sanitary measures, and monitoring of environmental hazards. Public health is what we as a society do collectively to assure the conditions in which people can be healthy. Public health is the science and art of saving the lives of millions at once by single decisions or interventions. This is the functions of public health. A system, public health is a system, as a profession, as a method, as a government services, or as the health of the public. The public health system, assuring the conditions for population health. Number 1, healthcare delivery system. Number 2, employers and businesses. 3rd, media. 4th, academia. 5th, governmental public health infrastructures. And 6th, community. Public health approach, there are two types of approach. One is the public health model and another one is the clinical or medical model. So we will compare both. Public health approach model is population based, it's a disease prevention, it promote health promotion, interventions, environment, human behavior, public and some private. While medical approach is the individual approach. It's a diagnosis, based on diagnosis, based on treatment, intervention just on medical care, and private and some public. This is the iceberg. What a physician sees, tip of iceberg, patient in hospital. What the physician does not see, patient in a community, mild or no symptoms, potential spreader. These are the core functions of public health. When we research, this is the research, it's a system management. First, we will monitor health, diagnose and investigate the community, inform, educate, empower, mobilize community partnership, develop policies, enforce laws, link to provide care, assure competent workforce, and evaluate. First, we will assess, then we will develop a policy, then assurance. Core activities of public health. Number 1, prevents epidemics and the spread of disease. Number 2, protect against environmental hazard. 3, responds to disasters and assist communities in recovery. 4, prevent injuries. 5, promote healthy behavior. 6, assure the quality, accessibility and accountability of health services. 7, monitoring the legal health status of population, mobilizing community actions. 9, reaching out to link high risk and hard to reach people to needed services. 10, researching to develop new insight and innovative solutions. 11, leading the development of sound health policy and planning. These are the 10 great public health achievements. Number 1 is the vaccination. Number 2 is the motor vehicle safety. 3 is the safer workplace. 4, control of infectious disease. 5th, decline in deaths from coronary heart disease and stroke. 6th, safer and healthier foods. 7th, healthier mothers and babies. 8, family planning. 9, fluoridation of drinking water. And 10, recognition of tobacco use as a health hazard. These are the problems and these are the diseases. Communicable diseases, non-communicable diseases, environmental pollution, maternal and child health problems, malnutrition and micronutrition deficiency, municipal and hospital-based, geriatrics health problems. Geriatrics means old age, early people. And last one is the population problem. Diseases are measles, influenza, poliomyelitis, tuberculosis, cholera, dengue, malaria, HIV, AIDS, obesity, cancer, and diabetes. Public health organizations, non-governmental organizations, national, while international organization we have, and United Nations we have. Public health organizations, governmental and others. District Health Office, Public Health Office, Regional Health Directorate, Regional Training Center, Department of Health Services, Ministry of Health and Population, Primary Healthcare Institutions, others, academic institutions, research organizations, community development organizations, quality control offices, health training centers, local development offices. Sample of public health professions. Number 1, population, family planning and reproductive health, maternal child health, public health education and health promotion, community health planning and policy development, public health administration, epidemiology and disease control, alcohol, tobacco and other drugs, environmental and occupational and safe health and safety, food and nutrition, gerontological health, HIV, AIDS, injury control and emergency health services, international health, mental health, oral health, public health nursing, school health education and services, women's health and gender development. These are the questions. Thank you.